your preparation before INI. So I'm Dr. Rahul Rajeev, and with me I've got Dr. Karthik, endocrinology faculty. So Karthik, welcome.
Thank you, sir.
Okay, so I think we'll keep it a very short, crisp session. And what we'll be trying to do is to just tell you if we were in your place and we have been in your place for such exams and what we would have done. And just a quick guidance session, and you can ask your queries in the chat box as well. So just a few points only. Point number one that we would like to stress is remaining, say, around 12 days for the exam. Please make each day count, because I know that we all have got commitments. Some of you might be working, but please make sure that for the remaining days, you give your full focus and attention for the INI preparation, okay? Because every question counts, and between, say, between colleges, you can just lose out on one question. So what I would say is that please give your full effort. And I would say a bare minimum, the last 10, 12 days, a bare minimum of 10, 12 hours per day. Bare minimum 10, 12 hours per day you have to devote to your studies. So Dr. Karthik, on that first point regarding the effort for the remaining 10, 12 days, quick, points from your side.
Yeah, absolutely. I would also start with what Rahul sir has emphasized. So give it your best in the last 10 days, because you may have assimilated a lot of information over the past few months. You have appeared for the NEET SS and may or may not have secured a very good rank, but it doesn't matter, because all it matters is the exam which is going to happen on May 24th. So starting with it, most of you would be having a baseline notes for medicine prepared for your NEET assess. So I would suggest you stick on to those, because that is one area that you are already familiar with. You may have already highlighted the points prior to the NEET SS exam. And I would suggest, instead of going through a whole new resource in the last 10 days, always stick to your strength. Go through your notes, go through the areas highlighted, and make it a point to cover it as a whole, rather than like sticking on to certain specialties. You should have a bird's eye view. That means you should rush through the points across all topics, across all specialties in a fast pace throughout the last 10 days. And regarding the time that should be devoted, I would say that depends on the person's level of preparation. Like some of you who feel that you are strong enough in your specialty and who have been preparing for so long, and you may devote more time for medicine. Likewise, if for the newcomers who are appearing for the first time, they may not have got enough time to spend that much time on their individual specialty. And those who are fresh from medicine, who have got their medicine topics in a strong fashion, those individuals can specialize more on the individual subject. So Rahul sir, I would like you to describe on, suppose those who have already gone through their notes now, who want to know what all resources they can make use of from the DocTutorials app for the app preparation and revision in the last 10 days. What are those available and how can you make use of them?
So I think one very important aspect of DocTutorials is we have got some good recall videos. And I think everyone has to go through each and every recall video uploaded in the app. Now, if you ask me for neurology, when I discuss a question that was asked, I try to discuss related points as well. For example, when I've discussed a question on monoclonal antibodies, in the discussion, I've given the list of monoclonal antibodies in neurology, mechanism of action, and the indication in a tabular column. So number one, I feel, is you have to thoroughly go through the recall videos. And that will actually help you a lot, because if you compare NEET SS and INI SS, I personally feel that the predictability of topics and questions for INI is slightly better compared to NEET SS. So if you just go through the recall videos thoroughly, now if I just go through the last time INI paper or even before that time, I have seen that for INI, around 3 to 5 questions, I've seen almost ditto repeats for each session. That is what I've seen in the previous papers. Okay, that doesn't mean that you're definitely going to get, but there is always a high probability and you cannot miss out on that. I think that is very important. And again, you will have related questions as well. I said 3 to 5 almost direct repeats, and you will have still further questions based on the topic areas, which means if there is a question asked on peripheral nerve hyperexcitability syndrome, that topic itself is important, and you may get a question based on a similar area itself. So that is very important. I feel the recall videos are a must. Karthik, in your aspect as well about endocrinology, how have you shaped up those recall videos?
Absolutely, sir. I second what all opinions you have that you have just shared. When we have around 5 to 6 recall videos in the last 2 to 3 years in the app, and if a student who is like rushing through those topics in 1.5x or 2x, they will come to know that certain areas are getting repeated each and every time. For example, in endocrinology, there would definitely be a question from diabetic ketoacidosis. There would definitely be some 8 to 10 questions from pediatric endocrinology, especially in short stature and pubertal disorders. And that too in certain syndromes, that biochemical evaluation. So if you feel that while if you're like going through the videos in a chronological order, you can almost guess what is going to happen in the latter part of the papers. So very important, you stress on those high yield areas that you will get to know. And I've also personally highlighted that whenever a question comes from this area, you should like go through this, and also these are all related areas. Such thing also I have included in the videos.
And one more point just to add, same question, Dr. Karthik, on the resources that you should be doing. And I would say that if you get time, I would strongly vouch to go through the ELITE test and discussion of the corresponding super specialty. For example, neurology part, I'm just telling you, we have done 4 ELITE sessions, 1, 2, 3, 4. And except for the first season, the remaining season all had test and discussion. The first was just about MCQs. So I can strongly vouch that if you have watched my ELITE season 2, 3, 4 discussion videos and my recall videos, I can confidently say that almost entire neurology I've covered through these questions. I'm very confident on that. So I would strongly vouch as the second strongest resource, the ELITE test and discussion of the corresponding. I'm not saying that you watch all the ELITE, at least if you watch it, good, but at least the super specialty topic that you are preparing for. So that would be another resource which would be very high yielding. Karthik, a quick take on that. LITND for endocrinology. How have
Absolutely.
you
And I think for every specialty, we have structured the ELITE, the previous last 2 ELITE, in such a way that we cover the entire topic systematically. We have divided into 3 to 4 systems so that the students can like get a touch with, rather than just discussing random questions as in the case of a grand test. This helps you in like enhancing your preparation as well as revision. So extremely important. And I would say even if you had already watched the ELITE TND like previously for your NEET assess, you can watch it at a very high speed, even for all the specialties. If you have enough time, if you had gone through the like ELITE TND first time around before the NEET assess, definitely you can watch it one more time, because I would say that some of my ELITE videos would be better suited for INI rather than NEET assess, because I have gone into more depth. I would believe that that is the case with all the faculty, as Dr. Rahul sir has just mentioned. So definitely ELITE is I would say it's a golden resource for INI preparation.
And just another point to add, I've got messages from many candidates. Sir, medicine, can we just go with our existing knowledge? And do you think rank deciding questions come from medicine? That is one point I want to tell you. Sometimes I have seen in certain INIs that the medicine questions can be very much rank deciding. So you please don't be under the impression that the focus should only be on the corresponding super specialty. There have been exams where the INI paper, the core paper, was relatively easier, but medicine questions were slightly tricky. And if any one of you feel that you've got some weakness in your medicine part, again, if time permits, the QRP, quick revision videos in the DocTutorials app available under the NEET SS medical group. Remember that we have got 2 types of INI, 2 types of QRP. For example, neurology, there is a INI QRP, and as well as there is a NEET SSQRP, and the same goes with all other super specialties as well. So I would strongly vouch that you can go through the QRP videos if you are falling short of time. And that is what you should be doing. And if I've taken multiple interviews of the toppers, even Dr. Karthik has taken, and something that most of the candidates appreciated about DocTutorials is how structured the course was. You know, whatever is required for you, if you are someone who is very thorough with the basics, then you can go through the revision videos, test and discussion videos like that. So what I would like to tell you is the remaining 10-12 days, your preparation should be, tailored to your need. What do you need? So that is what is important. Okay, that is what I want to stress, the importance of medicine. Just one more thing. There can be 0 to 3 questions from biostatistics. We have seen papers where no questions have come. I've seen papers where 3, and I think some time back I've seen one paper where 4 questions have come. There is a video in the DocTutorials app exclusively for this, which has been done by the PSM faculty of DocTutorials in the NEET PG segment. So madam has done a specific session for this alone, NEET SS, INISS. It's a very good session, and I would say that you should go through it. And I still remember, that those questions can also be rank deciding. I still remember a message from one of our students, I think Pranjal, who secured, I think, first rank for DM medical gastro in INI. He said that for the gastro paper, they had some questions from the biostatistics in the gastro part, not the general medicine part. So additional questions were there. So totally it came to around 7 to 8. It came in the gastro paper as well. So the weightage was that much. And Pranjal has actually watched Rajasi madam's video as well. So that also helped. So again, 0 to 3 questions is what I want to tell you. Okay. Karthik, any other point to add?
There is one question in the chat box that one of student is asking, should we cover the QRP of all specialty or just focus on the specialty that we are appearing for?
So that again, as I said, we have got 55-25, right? Approximate division. So I think medicine has to be given importance. So suppose you tell me that I have not, suppose you are planning for endo and I have not done neuro recently, I would strongly vouch that you go through the QRP as well. Again, it has to be based on your need. You have to assess, are you having any weak areas? Is any part weak for you? Then you will have to focus on those areas. Ideally, those 25 questions of medicine has to be given importance, ideally QRP of all subjects, but again, have to take into account the time considerations as well. Okay.
And of course, if you cannot go through all the QRP videos from all the faculty, you should definitely attend, you should definitely see the videos which we have done as live sessions in the last 2 to 3 weeks by individual faculty regarding the important questions that have been coming from their respective specialty in the last 4 to 5 sessions. And both me and Rahul sir has done the session, and we have highlighted where the endocrine questions for the medical part has been coming, like the DKA, the renal tubular acidosis, the endocrine hypertension, hypercalcemia. All these are areas important for the medical part because these are not extremely core endocrinology, but as a medicine resident also, you are likely to encounter so many of cases. So that's why these endocrine areas would come more often in the general medicine part. Like Rahul sir would also agree, right, sir?
Correct. I think it's very important, for those who are watching, I'm sure that most of you have watched those sessions live itself. But in case you have missed it, we have done a series of sessions based on the core topics asked for the medicine part of INI. It is available in the DocTutorials app. I think a couple of sessions, we have done it in YouTube live, it's available, but the others are there in the DocTutorials app. And please go through that. If you are short of time, those sessions will help you, because what we have all discussed in those sessions are the previously asked questions from the medicine segment of INI. So we strongly vouch that you go for it. Another point I want to stress is regarding the grand test. I'm sure that you would have given the grand test, and I'm seeing that good number of students are taking these grand tests as well. But one point I want to tell you is for the seriously interested candidates for INI, you have to just see the last 3-4 grant tests that you have given, at least last 3, and the mistakes that you have made in those grant tests. So those topics, it would be nice if you can just brush in the last, say, 10 days. Because, for example, you have made a mistake based on, say, anti-epileptics. So maybe you can just focus on those lines, the remaining few weeks, or maybe if you've got some question wrong on autoimmune neurological condition. So those important antibodies, paraneoplastic antibodies, you can go through it. So when you give a grant test, not only knowing the score is important, but whatever deficiencies you have got, it is important to cover up those deficiencies as well before you appear for the actual exam as well. So that is very important, going through the GTs. And also, we've got a very good question bank as well, which in fact, most of the INI candidates follow as well. So please make sure that you have adequate MCQ practice. So every day that you give, I would suggest that 25 to 30% of the time you can devote for MCQ practice as well. So, make sure that your MCQ solving is also good. Because sometimes what can happen is that in the quest of finishing the more and more topics, you tend to neglect the MCQ. So please do give enough time for MCQ practice, especially from QBank, and I hope from the grant test as well. Karthik?
Yeah, absolutely. And when we do the topper interviews as well, and I think almost all of them would have given all the grant test, and like surprisingly or not, their eventual rank, like those who have been consistently scoring within the first 20, would eventually end up with the top ranks as well. Because if you have seen the like rank achievers in the NEET SS as well, almost all of the toppers, more than 90% of the top 50 or 100 would be subscribers of a platform. So it is highly likely that all the people who are eventually going to get final like top 10 ranks in each specialty would be giving the grant test at the same time as you. So you will be getting a real-time practice. Like this is exactly similar to what is going to happen in the exam. Like the question pattern will be similar, the interface will be similar, and most importantly, the persons who are competing with are also going to be similar. So you'll get to know where do you stand, and you can understand your lacunae, your deficiencies, and you can do well to strengthen it.
Yeah. So one question I'm seeing. So elite videos, which season to focus primarily? See, it's not like that. Every season we try to bring a different set of questions, because one thing very unique about elite is that all the questions are framed by the DocTutorials faculty. So when I put questions for season 2 and then I go to season 3, I cannot put the same question. I have to frame a different question and come up with maybe the question can come from a related topic, but I try to frame in a different way. So I think my personal view is every elite TND is unique. Every set of videos for each season is unique. And I think it is one of the USPs of DocTutorials. I'm not saying this as a platform faculty. You can yourself watch the videos. Many toppers, they have binge watched the elite test and discussion. They said, sir, morning to night, I was just binge watching the elite test and discussion. So much so that, I had one candidate in an interview. He said he went to the washroom also and was watching the elite test and discussion video. So it was in a binge watching. So I would strongly vouch that every season is actually important. Okay, right. Anand Krishnan. Anand, see, good number of students actually take. The thing is that some of the candidates take the test live. But I would say that, Anand, most of the seriously interested candidates would take the question live. Correct? No. When you have a GT, some students will take it live and some students will take it maybe after it comes under the test series section. So what I would suggest to you is those candidates who took the live, they are the seriously interested candidates. If you look, I just saw that last time, Karthik, you had put that toppers from endocrinology, neurology. You just go through the last DocTutorials GT. It is almost similar. Again, I'm saying it's not as a platform faculty, it's a reality. It's just that, somebody who had scored rank 3 might be rank 5 or rank 5 might be rank 2, just like that. But seriously interested candidates, all of them will be giving the GT as well. Okay. And yeah, I think that's it. Any other point you have to add, Karthik?
No, sir. Just we can summarize what all things we have discussed in the last 15 minutes or so. So baseline, you should try to stick on to the material that you have, that you are familiar with. We have been practicing over the last 1 year. You have to keep it as a base. And to top it off, you can use the resources starting from the live sessions, highlighting the important topics, the QRPs. And I would suggest, if you are going for the QRP, there was a similar query also, which QRP should we follow, the NEET SS QRP or the INI? What do you say, sir? INI for the respective specialty and NEET SS for the other subjects?
Exactly. For the corresponding, if you're watching, if you're appearing for endo or neuro, you watch the QRP, because see, certain topics like neuro-ophthalmology, neuro-otology are focused in the INI QRP, but not so much in the NEET SS QRP. So INI QRP of the corresponding super specialty and NEET SS QRP for the other subspecialties is what I would recommend. Okay.
Then
Right.
you should definitely, if you have time on your side, you should go through the elite T&T discussion, and not to miss out on MCQ practice, and finally capping it off with appearing the grant test. Grant tests, some of them have already gone live, and you have to make sure that you are attending them, and whatever live grant test is remaining, you make sure you attend them live to exactly see where you stand, and at least in the last 1 week prior to the exam, you can do something about it in the areas that you are deficient in.
One quick query from Dr. Anoy. I think it's a very good question. Last 3 days before the exam. Now, this strategy can vary from candidate to candidate. I'm just telling what I would have done. Okay. It can vary from candidate to candidate, and I'm not saying that what I'm saying should be done. It's just my perspective. So what I would have done is the last 3 days, I already will make a note of the mistakes that I've done in the last 3 GTs, the topics, including medicine. Including medicine, suppose, I've made some mistake from this topic, I list those topics down, and those last 3 days, I would be just quickly brushing those topics so that I get a confidence that, okay, whatever were my deficiencies, especially close to the exam, I've covered up, and I've covered it close to the exam as well. So that is what I would have done. Karthik, your perspective, it can vary from, person to person, what you would have done. Because anyway, he would have finished all the topics. So, Karthik, so what last 3 days, but still for the others, you can,
Again, sir, I would not be reading up any new things. I like personally, I would just be solving MCQs, because I am not like very fond of revising theory in the last couple of days. I would just be practicing MCQs, especially in the areas that I found that I'm getting some wrong questions, like getting the questions wrong. I will be focusing on those areas, and I'll be practicing more of MCQs in the last couple of days. Again, this is not a hard and fast rule, as I told. It depends on the comfort level, the student preparation base, everything.
Yeah. And maybe regarding that particular exam day strategy, I think we might do another session later, maybe another 15-minute session on how you should approach the exam day, what should be your mindset. Maybe we'll take that on a different session, maybe a small chit chat very close to the exam, maybe 1 or 2 days before the exam, we'll have a quick chit chat. But I think we have answered most of your queries. But before we wind up, just one more thing we want to tell. Every year, we do the stage 2 preparation as well, the interview round. And, we started it off last several years back, when we were doing these mock interviews. So we already have got the question collection of the frequently asked the interview round questions. So we do train candidates for the interview round as well. So please stay connected. All of us have got the INI groups as well. So please be in those groups where we'll be discussing questions as well. And that's what I want to tell you. Stage 2, we have got a special preparation phase for that. So please be with us for that round as well. Karthik, any closing comments?
Nothing, sir. Just for the endocrine aspirants, I want all of you who are appearing for the IN endocrinology to make sure that you have watched the entire long videos, because the competition is so stiff in endocrinology that it has become so high scoring also. And I would tell all the students that the medicine part is most often the rank deciding one in endocrinology, because out of the 55 questions, at least in the last 3 to 4 sessions, most of them are scoring above 50. So that much is the top score in endocrinology, and there are around only 12 to 15 seats in endocrinology each year. So you should not afford to miss out on a single endocrinology question. So QRP standalone, I would say, is a very good resource material, but that would help you score around, say, 80 to 85%. But I would say that is not enough for endocrinology. You should aim for 95% to 100% strike rate in endocrinology, so that even if one or two silly mistakes happen, you would have a good pace that you have already covered.
So thank you everyone for joining, and thank you, Dr. Karthik, as well for your valuable inputs. So all the best, everyone. We'll be doing one more session also later. Thank you, everyone. Bye-bye.
Bye-bye.